We are live. Cancer is one of the leading causes of deaths in Uganda and Africa especially. And over millions of people die every day because of cancer. And today, Uganda Cancer Institute is hosting a 2-day conference on cancer and palliative care. And we are glad and we are excited to have one of the organizers and to have one of the doctors that are in Uganda who are fighting the cancer, to see that it is detected early and cured. So, without wasting much of your time, let me allow him introduce to you who is, what he does, and why he's passionate about the cancer, and why really he feels that cancer, since it is a non-communicable disease, how we can, the measures we can use and see that it is fought and ended in Uganda. Doctor, welcome to the show.
Thank you very much.
This is my first time to host a doctor on the show. I've been hosting young people, and of course advocates, activists. And today I'm extremely excited to have a doctor. So I'm also, I don't know if after the show I will be called a doctor. So
Maybe.
welcome to the show.
Yeah, thank you very much.
Yeah, you can introduce yourself to the audience and tell them who you are and what you do and the hospital that maybe you are now stationed on.
Okay.
Yeah.
Thank you. Good afternoon, viewers and listeners. I'm called Dr. Samuel Guma. I'm the Executive Director of Kawempe Home Care. Kawempe Home Care is a not-for-profit organization which really provides comprehensive care for patients with cancer, HIV, and tuberculosis. And we also do palliative care for our patients. And this organization has been around for around 12 years now, and we've supported very many people who have got cancer. We work in collaboration with the Uganda Cancer Institute. We actually get very many patients who come from there to one of our institutes, which is actually a hostel for children, and we provide for them psychosocial support to ensure that they can get access to the treatment at the Uganda Cancer Institute. Yeah, other than that, I'm also the Vice Chairperson of the Uganda Cancer Society, and I'm a former President of the Palliative Care Association of Uganda. So I've got quite a vast experience in caring for patients with cancer in Uganda. Yeah, I'm tuned a lot to palliative medicine, and I can share a lot of what we've done in Uganda as far as palliative medicine is concerned. Yeah.
You've heard what he does, and he's the managing director of Kawempe. So, Kawempe Home Care. Yeah, Home Care. So, doctor, here is the question. You said you were former Palliative Care Uganda Association president.
Yeah.
So people out there, they would like to know, what is palliative care?
Okay.
Yeah.
Yeah, palliative care is really, we call it holistic care, which is given to people who have got life-limiting or life-threatening illnesses like cancer, HIV/AIDS, end-stage heart disease or end-stage kidney disease, people who are facing life-threatening illness. And this care is total care, because we look at somebody's physical problems, which are usually caused by the disease. We focus on treatment of pain and treatment of disturbing symptoms, like severe headache, vomiting, diarrhea. But we also go further and look at social problems, psychological problems. Is somebody depressed? Do they have a problem at home with the family? Is there an issue which is making this person unhappy? So we look at a patient as a whole, and we try to go out and reach out and manage those different problems. We also look at spiritual issues, and especially for somebody who is about to pass on, they could be very concerned about where they're going after, And we've got spiritual counselors and advisors who really support patients to ensure that by the time they pass on, if that person will become comfortable with their God or whatever they believe in, to ensure that that burden of worry is relieved for the person. And we focus really on quality of life. We know that people have got, some of them have got terminal illnesses, like if it could be advanced cancer, which is not curable, and we know that somebody might pass away soon, but we do our best to ensure that we really give them a good quality of life, to ensure that by the time they are passing on, they are peaceful, they are comfortable, and they're not in distress. Actually, when somebody dies when they're in pain, it's really distressing for that patient, for the family, and the community at large. Yeah. So, quality of life is really what we look at when it comes to palliative medicine. Yeah.
The quality of life is what these doctors are looking at and making sure that every Ugandan and of course every patient is cared. Now, the person who is out there would like to know who really needs this palliative care and where can one go and get it.
And get it, yeah.
Yeah.
Thank you, that's a good question. Actually, palliative care is needed right at the time when somebody is diagnosed to have a life-limiting or life-threatening illness. If someone is diagnosed with cancer, from day one, they need palliative care. And that could be in form of counseling, psychosocial support, helping them to go through the news that they've got cancer. People go through some stages of even grieving when they get this bad news. So right from the beginning until the very end. And actually, palliative care is needed intensively towards the end of life because of a lot of problems like pain, disturbing symptoms which are making the patient uncomfortable. And we come in really to ensure that somebody who has advanced illness and is very sick or about to die is comfortable. We don't want people dying in agony. Yeah. So really right from the diagnosis until the end. Yeah.
Wow. Now is how, like, the cost, how can someone really, because we know we are living in our economy is not that good. So someone who has that kind of issue, maybe the cancer is not having the enough income to take care of himself or herself. What are those costs? How is the cost? Is it favorable? Is it affordable for someone?
Yeah. Actually, you asked initially about if someone needs palliative care, where do they go? Palliative care has actually been is widespread around the country. So many people have been trained, nurses, doctors, to provide palliative care services. We have at least in almost all regions of the country somebody trained to provide palliative care services. They could be in the district hospitals, regional referral hospitals, all around the country. We've also got organizations or what we call standalone centers where people can go to receive care. We've got centers in Mbarara, we've got in Mbale, we've got in Arua, we've got in Fopoto, we've got in Gulu, and these are places where people can go and actually get palliative care services. And really, in most regional referral hospitals, district hospitals, there are health workers there who have been trained on how to provide palliative care. We've got an umbrella organization called the Palliative Care Association of Uganda. And it's based actually along Entebbe Road in Chitende. And information can be got. Actually, if one goes to just Google in Palliative Care Association of Uganda, you can get all the details.
The areas are very
the areas, and even contacts of doctors or nurses in different parts of the country who can be called and
they are provided.
Yeah. Exactly. So we are really widespread over the country, and care can be got from those centers.
From the centers. So how expensive it is?
Yeah, cost is also another thing. What we've done, we know, of course, we're a resource-limited country, and we've come up with a list of essential palliative care medicines, which are easily affordable and readily available. And on that list, we have got a drug we call oromorphine. Oromorphine is extremely cheap, but it's a very good painkiller. People who are in pain with cancer should not be suffering in pain when we've got this medicine. But it's a restricted medicine, and it's really found in centers which have been accredited to provide this service. And of course, in all hospitals, we find this drug available, and most palliative care centers around the country. And if one is in pain, they should be able to go to those centers and will access this medicine. It's actually free. It's produced by the government of Uganda. So oromorphine is free and readily available. There could be some small costs for other drugs or other medicines, but for that major painkiller, It's free of charge.
It's free of charge.
Yeah.
Now let us dive into the the conference that is being hosted by Uganda Cancer Institute.
Yeah.
The theme is universal health coverage.
Coverage.
Yeah. Do you see any possible ways that we can achieve this
Yes.
by 2030?
Yeah.
Yeah.
We're
Yeah.
we're looking at universal health coverage for
Yes.
cancer and
Yes.
also
Yes.
palliative medicine to go
Yeah.
along with it.
Yeah.
Yeah. There's a lot which we need to do. There are very many things which are missing.
Yeah.
Of course, we talk about the major things we need are human resources, and we need to actually train many more specialists in management of cancer. We need more cancer centers around the country. Actually, a lot is being done right now. There's a center in Barara, Arua, Mbale is coming up, Ginger is coming up, and all these centers will be providing treatment for patients with cancer. At the Cancer Institute here in Kampala, it's now actually a center of excellence for providing cancer care in East Africa. We've got the radiotherapy machines right now, more are being purchased, and actually the latest technology for cancer machines is being imported. Okay, so very soon radiotherapy will not be an issue right now. Right now the machine we have in Mulago is working very well, and those who need radiotherapy can actually access it. Okay, so that is equipment. Yeah, but we need, of course, to decentralize cancer care. Imagine somebody coming who has been diagnosed with cancer, let's say in Gulu, traveling all the way to Kampala. There's so many problems people get: where to stay, what to eat, you know. Then there's money for transport, go to hospital. There's so many hidden costs which come that make people not be able to access care. Okay, so once we decentralize cancer treatment around the country, more people will be able to access the care.
Okay.
Right now in Kampala, Barara, Arua, still not good enough for the entire population. Yeah. So once we have human resources, equipment, medicines, medicines actually quite a challenge. Enough medicines.
Yeah.
And these are basically chemotherapy medicines. Then we shall be on our way towards getting universal coverage for cancer. And I think by 2030 we shall be there.
We shall be there.
Yeah, I'm very hopeful we shall be there.
Yeah, and I think in the morning there's one of she's a lawyer, and right now an activist and a cancer survivor.
Yeah.
She shared her painful story.
Yes.
She's called Ayebare Proskovia.
Yes.
And in her story she talked about how patients at Morago are suffering and how some of them are sleeping on the floor. And then I was like, and now when you say that now Molag is working and things are, at least they are moving, and patients are really being catered for.
Yeah.
And then I asked myself, so are these who are sleeping on the floor, or maybe those who are still suffering, or maybe those who are not yet taken to the machine to see how, so what's the problem?
It's a big problem. Like I said earlier on, there are very many social problems which our patients have. You know, ability to access medical care takes a lot of things. You know, like I mentioned, transport, accommodation, food, and also the fact that the Cancer Institute right now is shouldering the huge burden of the whole country. Actually, not only Uganda, but we've got patients from South Sudan, DRC, Rwanda, even some from Kenya come to the Cancer Institute for treatment. You know, so the patient load is too high.
Too high.
Yeah, the wards are overflowing. We don't have enough space actually where people could stay. I mean, there's no space for keeping everybody within the institute. So people are mainly treated on outpatient basis. And many of these people cannot afford to be outpatients within Kampala.
And sometimes, since the East Africa people also come to Morago, and the doctors, maybe there are few doctors and nurses are few to work on them, maybe that could also be a reason why they're sleeping there.
We need more health workers, we need more space, we need bigger wards, more equipment, a lot of that. And especially the challenges that patients themselves have. You know, some people cannot afford to go and rent houses or or live in hotels where they get their treatment at the cancer institute. So many of them are actually forced to stay within the hospital premises and find means of, shelter somewhere. So you find people on the verandas, others in tents, because they cannot afford to go and get accommodation outside the hospital. Yeah. And these are patients who are getting treatment on outpatient basis. Yeah.
Wow, thank you, Dr. People are watching. I see Mark. Mark is saying cancer should be stopped. Yeah, I think, yeah. Because, yeah.
Yeah, I think we should talk a bit about prevention. I mean,
Yeah,
since
prevention,
we've
yeah.
got
Yeah.
a younger audience, cancer prevention is really the way to go for our country. And many of our leaders have mentioned it. Today we had the Minister of Health, we had the Right Honorable Prime Minister, who was there with us at the conference, and the message was coming forward was really prevention, you know. And now when we go to prevention, first of all, people need to know what cancer is, okay? So we need education. The young people out there need to understand what cancer is exactly, you know. And then once you understand it, how it presents, and what we can do to prevent it. And I'll just give a few tips for the audience. First thing on the list is healthy eating. Fruits, vegetables. We need to have that one in our diet. Second, exercise. There's a campaign, a national campaign, which has come up actually led by His Excellency the President of Uganda,
The physical exercise.
the physical exercise activity. We should not sit there in our homes on our phones and listen to music all the time and just eating chips and chicken. We need to go out there and exercise. We need to put it within our programs of daily physical activity. Actually, what an adult needs, somebody who is above the age of, let's say, 15, needs to have at least 30 minutes of good physical activity every day. Then for the children, they should have at least 1 hour, of running around, playing, sweating. That's one of the measures which helps prevent cancer. Now, there are these other cancers which are caused by particular, you could say, like viruses, like cancer of the cervix, which is caused by human papillomavirus. Now, there is a means of preventing this cancer for ladies. There is immunization of young girls at 10 years old
10 years.
for a vaccine. They get just only 2 shots and are protected for life. And there are many other cancers which can be prevented. And also early screening, also for those who have been exposed, like for breast cancer, prostate cancer, and many other cancers. Once you go and you get screening early, you're able to detect a cancer early, and then your treatment becomes actually much easier, and the chances of cure become much higher. Right? So knowledge is really important, and we really urge people to go out there and get more knowledge. Cancer is not witchcraft. Many people think cancer is witchcraft.
And you've talked about the prevention.
Yeah.
Only.
Yes.
I wish you could also talk about the causes, the few of them.
Yeah.
That we can try as much as
possible to prevent.
Prevent.
Yeah. Of course, when we come to causes, there are very many predisposing factors. But key on the list, tobacco. Use of tobacco, smoking. Smoking causes so many cancers in the mouth, the food passage, the whole gastrointestinal tract can be affected by smoking, and also the lungs.
And then now, when you're talking about tobacco, we see the industry, tobacco in the tobacco industries, the tobacco people, they keep bringing it, and we have a lot of, but
actually the use of tobacco in Uganda has gone down a lot because the government has there are heavy taxes on tobacco. Advertising is not allowed anymore, and even on the packets of cigarettes, there's a health message that it can cause heart disease or cancer. So really, we are seeing trends of smoking really on reducing.
Declining.
Yeah. However, there's the young people actually, the ones who are still really engaged in this activity. There's a lot of even other things like shisha which are being used. All those have got a potential of causing cancer. And I'd like to really reach out to people and say, smoking shisha or cigarettes
Really
can cause cancer.
And I think sometimes when you look at what the young people say, or maybe someone who is smoking tobacco or maybe a cigarette, I'll tell you sometimes whenever I smoke it when I'm stressed I smoke it, and then I get back to my normal situation.
Yeah,
Yeah, those are some of the reasons. Like when I'm stressed, I can.
I know.
Yeah,
But there are many ways of relieving stress, and jogging is one way, one good way.
and maybe
Doing some
there's,
physical
and
activity or
maybe
sports can also help relieve stress. Going out dancing can relieve stress. So smoking is not the only way to relieve stress.
so
Yeah.
it's not shouldn't be an excuse.
No, it should not be.
It shouldn't be. Yeah, you're still
Yeah.
mentioning more causes of
Yeah. Smoking, use of alcohol. Alcohol is known to be one of the risk factors of liver cancer. You know. So we need to really reduce. Alcohol abuse really can cause very many hazards to one's health. So that one should also be reduced. Now there
even
are
I
also
think
other
even alcohol
causes.
it damages the kidney.
Yes,
Does
there
it?
is also on the liver.
And
Yeah,
the liver.
mainly the liver. Yeah. So the other cancers which are caused by viruses, you know, there are some cancers which are found more in people who have got HIV. Cervical cancer is one of them. It's more common in women who have got HIV. And also the skin cancers like sarcoma. So for those who have got HIV, it's important for them to be screened for those cancers. And if they're found, treatment should be done early. And for HIV actually, once someone has got HIV, we've got medicines throughout the whole country, the ARVs, to control the virus. So those who are HIV positive really should be in a treatment center, take their medication properly, and the risk of those cancers will actually reduce. Once the immunity is strong and they're able to go about their normal activities.
Wow. So we have smoking, that is tobacco.
Yeah.
We have drinking alcohol. So these are the things that we are supposed to stop
Yeah,
doing.
the youth
I
have
see,
to, yeah.
I see my producer is is laughing at me. I think he knows some things, but of course,
Yeah.
as a young person who's listening, you hearing this from an expert, not from a young person like you. Maybe sometimes me, I could come and I tell you, man, smoking is bad. Maybe I will tell you, stop drinking, and then you will tell me all the reasons why you're drinking. But today, you've gotten a chance to listen to the Dr. Guma, and then he's telling you that, you know what, the kidney it does, it affects your kidney, it affects your liver, and of course, the cancer, that is the major biggest problem we do have. Yeah. So
You
what are,
forgot, you forgot a part of what they call a sedentary lifestyle. Just being alone, quiet, and being to yourself on your iPhone or your iPad, and really not being active physically is a major problem for the youth. And the trend's actually getting worse now. With our phones and gadgets and everything, video games, somebody spends a whole day on a video game, in their house, from morning till evening, they don't do any exercise. All those are leading us towards no cancer. Yeah.
because of the gadgets,
Not the gadget itself, but just lack of physical activity.
lack of physical
Yeah.
activity. But right now, when you talk of that, sometimes these young people have jobs on the
The
phones are
gadgets.
their
Yeah,
their
true.
offices. So what
Yeah.
could be now the solution for that? Because they will tell you this is our office.
Yes.
Yeah, and we are getting income from
Yeah.
it. So maybe if we could get better or what,
I
we can
understand.
leave it. But so what?
But of course, everything we should do in moderation. We can't spend the whole
Day,
20 hours of
20
our
hours.
day really on the phones and the gadgets. If it's what you're using for work, please go ahead and use it. Because that people also go to their offices, sit on their computers for long hours. But what's important is every day spare 30 minutes and go and do some good physical activity.
And even spending the time on the phone, like looking at the phone, even affects the spinal cord. If
Yeah,
the
of course,
sitting postures now
yeah, all those things, all those happen.
those
Yeah,
things happen.
some of the side effects, yes.
Yeah, those are some of it.
Even people who are in offices on their computers, they're there the whole day like this, they get all those problems. Yeah. So it's a thing of technology. Some of the problems technology is giving us.
Yeah, that is one of the effect of technology. So phones, try and spare some 30 minutes, go do some physical, simple exercises, run, get that ball,
Yeah. Yeah.
and of
Actually, the
course,
youth like dancing.
yeah.
You can put on music in your living room and dance You know, whatever dance they're doing, but make it really active. Dance for your 30 minutes, making sure you're jumping up and down. Yeah, that would be good exercise for you. Yeah.
And even when you are dancing and when you are like you are happy, you concentrated, like even the brain itself,
Yes, becomes more
it's
active.
yeah,
Yeah.
it settles what you've been thinking about.
Mm.
Sometimes it goes away in that small time that you've created for the exercises. So doctor, what you I don't know if you mentioned the challenges of some of the Ugandans in accessing these palliative care services. Yeah, if you could mention one or two.
Yeah, there are a number of course limitations to access. If you imagine somebody in a remote village, the next health center is probably 5 kilometers away, you know, and that's where probably at that center, that's where the palliative care team is and everything. For them to leave their home 5 kilometers away to reach the health center is a challenge. Okay, the transport costs, the arrangements for the family to get the patient there, all those become real challenges. And of course, resources becomes a major challenge. And also, once you get to the hospital, within the hospital itself, there could be a lot of dynamics. You know, which day is the team available to see patients? How do you enter? Are there any challenges or barriers to access to care? Many patients actually reach hospitals and they get lost. You know, and that's why now there's a new concept of patient navigation. So once somebody gets to the center, they need to be shown around where to go, what to do in order to access care. Yeah.
So
So
more even the sensitization needs to be done when
yes,
someone is there.
exactly.
Exactly.
Yeah. And I mean, we should not leave it alone to the government. I mean, there are private organizations which move around in the communities helping patients who are unwell. All those can be used to really increase access to the care.
And even sometimes we push it to the government, and then we're like, who is the government? The people are the government.
Yes.
So we should take care of ourselves. Sometimes these things we need to go. So I know there are some misconceptions
Mm.
that are around palliative care,
Yeah.
and and we would like to know some of them, and really you tell them that this is the misconception that people have, and
Yes.
this is what is right and this is what is not right.
Yeah.
Yeah,
The biggest misconception about palliative care is that it is care for people who are going to die.
that's the first one.
Yes. And so many times we get challenged that once the palliative care team is called to a patient, everybody says
That one is going
that
to
one is
die.
going to die. And that's a very big problem, you know, because some people, of course, now will not be so receptive to the care which they're going to receive, you know. And like I said, palliative care really is for anybody who has got a life-limiting or life-threatening illness. Many of these illnesses, for example, cancer, some cancers, if they're detected early, can be cured, you know. So palliative care can come in for the time when it is actually needed, you know. And let's say like also for HIV, people who are HIV positive also get palliative care because they could have, let's say, a severe illness like meningitis, which is really extremely painful, a lot of headache. So a palliative care team can come in and help control that pain during that time. But once the patient continues getting their medication, they get better, the headache goes away, and they go back to their normal lives, you know. So it is not only for people who are dying, it's for people who need particular interventions in terms of pain and their symptoms, and also other social and psychological problems. Yeah.
Yeah, there's I think we should first is this question I've seen.
Yeah.
You talked about the exercises, the dances,
Mm.
walking, doing the football, doing the
Yes.
all the
Exactly.
exercises.
Yeah.
So and there's this person who is watching right now is asking, doctor, is sex a good exercise?
There's a interesting question from young
Yeah,
people.
of course, it's a young person. It's now it's like, is sex a
Yeah.
good exercise for
Okay,
real? Yeah.
I'll talk about sex. Really, sex is an activity which should be done with the right circumstances. Okay, and number one, is a boy and a girl or man and woman ready for that particular activity? Are they both psychologically prepared? Are they doing it the right way? You know, among the youth, when you talk about the right way, do they know each other's status? Do they know if they are free from STDs or from HIV?
Is there consent?
Is there consent? Of course. Um, is it being done safely? You know, are they using condoms? You know, especially for the youth. You know, once all those factors have been put into consideration, it's actually a good physical activity, and it also helps really internally. The act actually releases what we call good hormones, which actually make somebody have a good feeling afterwards, and that also helps really in terms of physical activity. Yeah, so it's a good physical activity, but should be done
appropriate. It's
Yeah.
a good physical activity.
And yeah, of course, the priest will say it has to be between a married man and a married woman, but we know what happens to the youth. But if it's done safely with consent,
Yeah, consent is key
yeah.
when you are not married, and
And
even
of course, for those who are
if you
above
are
18
even
years
if
old,
yeah,
above
it's for
18 years
those who are,
old,
so those who are still below 18, yeah, you
Yeah.
can still abstain.
they abstain.
Abstain, yeah.
Yeah.
Abstain from it, because the sex is not going anywhere.
Yes.
You will, you will find it.
There's a right time for it. There's no
There
need
is the
to
right
rush.
time for it.
Yeah.
You will find it at any time. When the time comes, you will have it, and then
Yes.
every day you want it. So, as I think the time could be is not on our side. Uh, for now, if you could tell us some of maybe recommendations that the government can do and see that our Ugandans, the cancer is detected early,
Yeah.
and those who have it, and see that they really
Yes. They
go
really get help. Yeah.
get the service.
Yes. Really, the government of Uganda is the biggest stakeholder in this issue. They've got a very big role to play. They are really advocating for prevention, and really for a low-developed country like ours, prevention is the most economically viable method to use to really control this disease. And we've talked about how cancer can be prevented
Yes.
through exercise, through immunization, through very many avenues. Eating healthy foods, you know. And but still, once somebody gets cancer, we should be able to detect it early, you know, through screening programs for the breast cancer, for prostate cancer, for cervical cancer. And once we do that, then we can be able to treat quickly, and somebody gets cured without having to suffer very much. Those who get advanced cancer, of course, there's treatment at the cancer centers around the country, and also palliative care, which goes hand in hand with the care for the patients. We need to have more access to palliative care services and cancer services. All the regional centers should be really having a cancer center where people can go and get treatment. And yeah, by surely increasing access to cancer and palliative care services, people can get a better service and really manage the disease much better.
Much better. Yeah, you've talked about the cervical and prostate cancer, so I was like, but if the doctor says something, at least these two, from both from the prostate, that is for men, and
Yeah,
then
for
the
men,
cervical, and then for,
for women, yeah.
yeah, for women. So
Yes.
if you could at least talk about it a little bit.
Yeah. Cervical cancer is really a cancer which is caused by a virus, which is sexually transmitted, and it affects the cervix, which is the mouth of the womb of the uterus. And this cancer goes in many stages. It begins first by changing the appearance of the skin on the cervix. But then later on, it breaks out and becomes a wound, and it starts growing. A big tumor mass grows. That's when it's now in advanced stages, and it spreads to other parts of the body, made the local organs around the uterus, and later to different parts of the body. And it's really very, very lethal. Actually, it's the most common cancer among women
Among women,
in Uganda. On the other hand, prostate cancer is really a cancer which affects the prostate gland. The prostate gland is just found below the bladder, and it really surrounds the urethra, where urine passes. Okay? And once men get it, then they start getting problems with passing urine, back pain, really very distressing, and it now spreads to the bones. It eats up the bones of the spinal cord. It can lead to somebody getting paralyzed. It's a really, really terrible disease and it has a lot of problems. But the earlier the diagnosis is made, the better.
The better.
Yeah. We've got radiotherapy, we've got chemotherapy, we've got treatment called hormonal therapy, also which helps for the prostate cancer. Yeah. But early diagnosis is key, and really we ask all men who are above 40 years old to be screened at least once a year for prostate cancer. It's a simple blood test which we use for screening prostate cancer.
All right.
Yeah.
So, thank you, doctor. So, people are watching right now. You could at least tell them where they can find you, the days you are there in your office.
Yeah.
Yeah, because I know people out there, they would want to reach out to you and talk to you. And
Yeah. So like I mentioned, I work at Kawempe Home Care. We're located in Chevando. It's my full-time job at Kawempe Home Care. It's along Gaza Road. And yeah, actually once you go to Google, you can get more details of our telephone contacts and even the physical location, Google Maps. You can be able to reach us there. And I also mentioned that I'm on the board of the Uganda Cancer Society. So I also work at the Uganda Cancer Society, which is based in the Uganda Cancer Institute. Yeah, I'm there occasionally for meetings and for workshops, etc.
yeah, so before we close, what are the expectations of at the end of the conference?
Yeah, at the end of this conference, I mean, really there are very many health workers and people from the general public who have come here to learn. My expectation is for people to be more aware about the burden of cancer in this country. Every year, almost 22,000 people die of cancer in this country. We need to be aware, and people who are here actually, from people from civil society, from government, we should all know that we've got a role in carrying or reducing the burden of cancer in this country. So we should all really make appropriate strategies to really reduce the burden of cancer in Uganda. That's my major expectation. Those in government have their roles, civil society have got their role,
And the citizens.
citizens have their role.
Have their role. Your last words?
Yeah, my last words, prevention, prevention, prevention.
Prevention.
I've mentioned the measures to prevent cancer. Let's put that to the top of our agenda. Thank you.
Thank you, doctor, for coming.
You're welcome.
Yes. For now, bye-bye. See you next Sunday. Thank you for watching. Thank you, doctor.
Yeah, thank you.
Yeah.
All right.
All right. People and sex.